to the Age of Central Texas YouTube channel. So if you miss one, you'd like to watch it again, like to share these resources with others, just go to the Age of Central Texas YouTube channel to be able to view them. We will send you links at the end of the week, including some resources that you've learned, as well as the PowerPoint slides from each of the presentations and a digital copy of the event program. Also, an ASL interpreter has joined us for these sessions. So to better view the interpreter, you may pin the interpreter's window by clicking the blue square with 3 dots in the upper right corner of the interpreter's window. Next, we will email a survey to you after the session. So please complete the surveys as soon as you can while the content is still fresh on your mind. And your input helps us to plan future conferences, help other caregivers, as well as provide metrics to our grantors. And my colleague, Shirley Trapani from AAA, she's going to tell you a little bit about a survey that she would like everyone to complete. So Shirley?
Thank you, Bobby. Hi, my name is Shirley Trapani, and I'm with the Area Agency on Aging of the Capital Area. And I wanted to share, and I've already shared it in the chat. We have a survey that has just come out through the Health and Human Service Commission. It's called the 2026 through 2028 Texas State Plan on Aging Needs Assessment. And the Texas Health and Human Services Commission is conducting a needs assessment survey to gather input from older adults, the caregivers, service providers, and stakeholders. And the feedback is very essential. I took the survey myself, very quick, very easy to do. And it addresses the needs of our priorities of our aging population. It's going to look for challenges, allocation of resources and funding, and help improve and develop programs that support healthy, independent living for older adults. And I did place the link in the chat, and we would very much appreciate everyone taking a few minutes to complete that. It does close on August 26th by 5:00 p.m. And thank you for your time, and we thank you for completing that.
All right, thank you, Shirley.
Thank
now,
you.
finally, we want you all to remember that this is your conference. We want you to feel comfortable and ask questions during the Q&A session. So if you look down at the bottom of your screen, you'll see the Q&A feature, and it looks like a little dialogue bubble with a question mark inside of it. So click that, and the Q&A will pop up on the side of your screen. So don't hesitate. Type your questions as they pop into your head. And when the presentation ends, we'll go through each of your questions one by one. And now I'd like to introduce Tomas Montano from Vitas Healthcare, who's our today's session sponsor. So Tomas, thanks for joining us.
Yes, thank you for having me. Can everyone hear me?
Indeed, yes.
Awesome. Well, thank you guys so much for having me. I appreciate the Area Agency on Aging and Age of Central Texas for having us. Both have great resources for caregivers. I've sat in on some educational pieces with the Area Agency on Aging, and AGE as well has provided a lot of resources for our patients. So I want to introduce Vitas real quick and what we do and how we help caregivers. So Vitas is the nation's leading and oldest hospice provider. We've been doing it for over 40 years. We actually created the Medicare hospice benefit back in the 70s. So if you think back, to even think that hospice wasn't a thing before then. And so if anyone knows hospice, we do. And so one of the big things that we've noticed is really being able to take care of, people who are caregivers. A lot of times we don't talk about caregiver burden. And that's a huge thing that, with hospice comes having a social worker and a chaplain. We always think about our loved ones, and I think the biggest thing is caring for our loved one on hospice care, but hospice care is also for the caregivers. And I think that's something that needs to be talked about, and you should take it into consideration when coming on hospice, that you are also receiving care from your hospice provider as well. So whether it's getting you resources out in the community for your loved one or yourself, or just having our chaplain pray with you, or just sit with you and just talk through your loved one's diagnosis. We're just here to support you and help you through that journey. One of the things with hospice care is you receive bereavement support, and we don't like to think about after our loved ones passed, but it's really good to prepare for that, because we don't really know what grief comes after that, how long the grief is going to be. And so being able to work with your chaplain and social worker, we follow you 13 months after your loved one has passed. So we're going to be in constant communication as much or as little as you'd like, and just really support you. We know when that 1 year comes up that we want to add an extra month of support for you. So, and then another thing that VITAS does specifically is we do memory bears. I think that's really, our families love it. We have volunteers that sew up memory bears of your loved one's clothing, whether it's a blanket, clothing, just something that means a lot to them. And we make like little bears for the grandchildren, and then big bears for the spouse or the daughter or son. So a lot of support for caregivers, and not even just after that your loved ones pass, but during that time. I think a lot of times I connect people with when they're not hospice ready, just really uncovering those misconceptions and getting them to the right resources that they need. So we're just happy to be part of this caregiver conference and supporting you in any way. We will be there on Saturday if you're coming in person. So if you have questions, definitely stop by our booth.
Tomas, thanks so much for sponsorship and for all that you do throughout the community. You do a lot of great work. And it's
Thank
now my
you.
pleasure. Yeah, sure thing. It's my pleasure now to introduce Rhonda Thompson from AAA, and she will tell you a little bit about what AAA does and also introduce our speaker.
Thanks, Bobby. Yeah, the Area Agency on Aging, or the other AAA, sometimes people are used to the CAR Club. We offer supports and advocate for adults age 60 and over. All of our services are at no cost to the individual. We do cover 10 counties, so we're spread out all over, both west and east of Austin area. We help with information, referral, and assistance, Medicare information, education, and advice. We also have a caregiver support, education, and respite team that offers tremendous services to caregivers. And I'm the health and wellness coordinator. So we offer classes, a variety of classes as well. And we have additional services. I don't want to take up too much more of the speaker's time, but we have we do a lot. So check us out. We're excited to be at the event on Saturday. We've been there for 24 years now, as Bobby said. And so this is exciting to be there to offer services to folks. I am pleased to introduce Julie Latson. She is the Director of Strategic Partnerships of CareFor, a care management and private duty home care firm. That's a lot. Headquartered in Austin, Texas. CareFor is also a private professional guardianship program serving as guardian of the person and guardian of the estate for individuals in 7 counties surrounding Central Texas. Wow, that's a lot of good stuff too. Julie has a Master of Healthcare Administration from Texas State University and a Bachelor of Arts in Sociology from Sam Houston State University. She's had the pleasure of working in senior living, home health, hospice, and private caregiving services for the last 23 years in Austin. And she's born and raised in Texas. Woohoo! And she's married to her husband, Shane, and has 2 sons, Wyatt and Hank. And we're excited to hear about navigating systems of care. Thanks, Julie, for joining us today.
It's a pleasure to be here. I'm going to share my screen so y'all can see the presentation as I talk. It may be more exciting to look at than my face. Let's see. Okay, here we go. So I really appreciate the introduction. I'm very grateful to be here. We are talking about a really large topic today, which is navigating systems of care. I feel like you could almost break this up into several presentations. So we're going to do a general overview. And then if there's any questions at the end, please don't hesitate to post those so we can get all of your questions answered. But a little bit about CareFor before we get started. We are a care management firm that was founded by a registered nurse. Her name was Debbie Pearson back in 2000. Her mission was to help clients navigate the healthcare system, provide advocacy from a personal perspective, because everybody has different wants, wishes, and desires for their aging process. And over time, over the last 24 years, it's grown from a private care management agency helping clients advocate their healthcare needs and wishes to a full private caregiving firm. We do payroll processing for private caregivers. We also can serve as medical power of attorney and have a full guardianship program. So we try to be a one-stop solution for families that are just having trouble figuring out the next best step. Jumping into the topic of navigating systems of care, I want to break it into two different pieces. So the first system of care is the system that you set up in your home. And so that can be private caregiving services. Sometimes it's a private caregiver, just you, or when you bring in someone into the home. An agency is an entity that's licensed, bonded, insured by the state. And if someone doesn't show up, they replace that person. Or you can hire a private person. Sometimes these are friends of family. Sometimes these are former housekeepers that are offering to step in and help support a loved one. So those are two options for private caregiving services in the home. There's also home health and hospice. Then there's the out-of-home care system. So that's your hospital systems, your inpatient rehab, community options, adult day programs. So various entities that are not there in your home. And we're going to look at the different pieces of those two. This I feel like is just a really nice reference sheet, and I've offered for this to be extended to anyone that's attending this webinar. But this is a resource that we've developed for our families and for just really anyone who needs it, which breaks down the different opportunities for help, call them systems of care, if you will, but where care can be provided, when is that care appropriate, clues as to when it's no longer working, and like a general cost of what that care may look like. And so we won't go line by line through this particular form, but if you're interested in having it, please let the team know here so we can get that information to you. We're going to dig a little bit further in on further slides, but I did want y'all to look at the various options for placement that are both in the home and outside of the home. And it goes from the least restrictive, which is private home and having people come in and support, to what would be considered more restrictive, which is the skilled nursing facility, which is your highest level of care outside of a hospital setting. So when you're thinking about navigating systems of healthcare, it's really helpful to understand who pays for what. And a lot of people are under the impression that Medicare is going to take care of all of their needs. And that's really just not going to be the case. So you have the entities that are covered by insurance, and we'll talk about what those are. And then we have what is covered by private pay. So of course, if you're a private caregiver and you're providing that care, it's typically an unpaid service. When you start bringing care into the home, that's a private pay model. And really the only payment source that will help to cover that is either long-term care insurance, or if someone has Medicaid and Medicaid's approved for a certain amount of time in the home. Now, insurance will cover some support in the home, but it's very limited and it's more geared towards rehab. So your home health is covered by your Medicare insurance, or if you have a Medicare Advantage plan, it's for a short duration of time, and that can be a benefit for a temporary solution. And then hospice care, similar to what Vitas provides, that's also covered by a Medicare benefit. Again, that's a nurse visiting the home. There's some supportive services, but hospice and home health do not provide one-on-one care. That's really what's being provided by a private in-home care agency, or if you go into some sort of facility setting. As you're looking at different healthcare systems and how to advocate, it's really helpful for you to understand what your insurance network covers, who provide your insurance. There's a lot of confusion typically regarding whether you have traditional Medicare, if you have a Medicare Advantage plan, if you're under the age of 65, if you're a PPO or HMO plan. So having a good understanding of who's going to help cover your benefits is really critical to understanding what you may or may not have access to. And then long-term care insurance, again, this is something that people tend to buy when they're younger. Insurance premiums are a little bit less because you're more healthy. You pay for it over time. And long-term care insurance can help cover the cost of private in-home care as well as senior living options. There's also nuances to how that program works. So sometimes there's elimination periods where you have to be prepared to pay out of pocket for a period of time. And then there's generally a daily rate that the insurance provider will cover, where you may have to supplement if the cost of your service is beyond what the long-term care insurance policy will provide. So just taking a dive into your insurance, looking at your insurance cards, requesting a benefits manual will be very helpful for you if you're needing to access healthcare systems, so you understand who's going to pay for what and what resources you may need to cover that are not covered by insurance. So healthcare systems in the Austin area. And when I say this slide, it's specifically for in acute, how about that? Acute settings. So hospitals, inpatient rehabs. You've got systems like Ascension Seton, St. David's, Baylor, Scott and White. Those are kind of your big ones for our Central Texas area. There's a couple of rehab, not skilled nursings, but actually inpatient rehabs as well. So you have Encompass Health, you have PAM Healthcare. Understanding what system you're in is helpful, so that way, if you're needing to transition through a system from a hospital setting to an inpatient rehab setting, it's very helpful to know if they are talking to each other. Or if you have a hospitalization, come home, everything's good, you end up going back to the hospital. Ascension Seton and St. David's, they can talk to each other, but it's going to be a much more smooth line of communication if you go back to the same healthcare system for any services or healthcare needs that you have. So when people go from one hospital system to another, there tends to be more of a breakdown of communication between the healthcare systems in Austin and really anywhere. Whereas they can share information more readily. If you went to St. David Central and maybe next time you went to St. David South, those entities generally can talk to each other. So it is important, if at all possible, to try and stick with one system. Or when you're accessing a different healthcare system, make sure they know early on any previous hospital stays so they can start working to get that information, because they would not already have that in their system. This also goes with alignment of medical providers. You need to ask your medical providers, are you affiliated with a particular system? we are no longer in the days of where your primary care provider will go visit you at the hospital. It just doesn't work that way any longer. But there are groups that are affiliated with systems where there's going to be a more smooth flow of communication between the system and the healthcare provider, which is really important to you as you're navigating a healthcare system, because you want to make sure that when you're coming out of a healthcare system, you're being discharged from a hospital, that your medical providers know, did they change any of your medications? You know, what was your recommended plan of care? What was your recommended follow-up? And having those insights into that good continuity of care is important. And then similarly, if you're seeing specialists or anything like that, if they can be affiliated with the same system, would be ideal. So that way they're all just easily talking to each other. It's also helpful just to find out if your medical providers have any relationships at all with senior living communities or skilled nursings. Usually they don't, and those entities have their own medical providers. But as much of that conversation and communication that you can have up front and letting them know where you're at in your journey, it's going to make everything run more smoothly, because people will understand your situation and be prepared to communicate with new providers that may be coming into your life. So keeping that at the forefront and asking those questions, particularly if you're just getting established with a provider, or even if you've had a longstanding provider and you've never accessed a healthcare system, ask them what their recommendations are. Who do they have good communication with? And so that way you'll have good insight into, if something were to happen, where you should request to go, or your loved one. When we're talking about navigating systems of care, I could say it over and over and over again, but communication, communication, communication. And at the heart of all of this is us as an individual owning what we need to have readily prepared to provide our providers, whether it be your doctor, the hospital, the emergency room. It needs to be current, and it needs to be as accurate as possible. So this is a little cheat sheet of different things that we recommend that you have prepared and on hand for assistance in navigating the healthcare system. Medication list is a big one. Usually people have medication lists, but they're not always up to date. And so I have been involved with many a family because a lot of my background comes from senior living and even in independent living. If there's an emergency and EMS is called to your home or to your independent living apartment, they're trying to figure out what you're taking. And if there's not a medication list that's current, they end up trying to dig through prescriptions that are on the counters or found in cabinets, which may or may not be anything that you're still currently taking. So having a current medication list is key to making sure that the hospital knows what you're on or what your loved one is on. Your allergies, the names of your doctors, including specialists, and phone numbers is very helpful to make sure that when you're in a system that they know who your providers are. So if there are questions about anything, they would be able to reach out and communicate with them, as well as follow up and make sure that the discharge plan is communicated to your primary care provider. Any diagnoses that you have needs to be included on those medical forms. So a list of your conditions, any hospitalizations, which is next on their surgeries, procedures that you've had. General date is super helpful for a healthcare system to have. Same with your health insurance. So copy of the cards, all of this should be included together, front and back. You want a list of current immunizations, if you've had the COVID vaccine, if you have not. And And then your social security number, which is also separate from your Medicare number these days. So that needs to be documented somewhere. And then also your code status. So, and there's going to be another slide related to this, but making sure that you have, whether you want to be resuscitated in your home or not, is posted there. There's a form called a Texas out of hospital do not resuscitate, which is a specific form, making sure that these items are readily available. I did provide to Age of Central Texas an editable form. It's called My Medical Demographics. And if you're interested in having this, we can provide it to you. But it's a form that it helps to outline all of the things above. And as things change, you can update it and save it as a new copy. So this should be just a part of something that you're regularly keeping up with, just like you keep up with a calendar for future appointments. If you have a doctor that's changed a medication, you just need to go back into your medical demographics form and update the new medication prescription that you have. So it's constantly current and readily available if there were ever to be an emergency. When people are in senior living communities, this type of information is usually provided by the community to a healthcare system on their behalf. And so they will help you keep up with these things. But if you're going out to the doctor on your own, or you're taking a loved one out to the doctor, and they reside at a community, a facility, you need to make sure and get that information back to that community so that way they can update their systems. They can make sure that if there's a medication change, it's adjusted properly. It's just, again, it's communication, communication, communication. And documenting it is so important, because if you can't speak for yourself, people need to know what to find and what may be going on. There is a program called Vial of Life, VIAL of Life. And there's a website you can go on, and it's this tube where you can put these documents in a tube. And usually EMS looks for it in your freezer, which is kind of odd, but you can leave it on the counter next to your refrigerator. Some people will put sheet protectors and a magnet on their refrigerator if you don't do the Vial of Life. But really neat tools to use to have this information. And this is how EMS knows to look for these types of things. They actually go to the refrigerator and they'll look and see if you've got the magnet, and if you have a Vial of Life with all of this information stored in it. Again, the more information you can provide, the better outcome you're going to have. With that, navigating a healthcare system is great if you're doing it for yourself or if you're doing it on behalf of someone. But one of the things that you must have in order to really be effective in navigating a healthcare system are your legal documents. So think about who has authority to act on your behalf or for your loved one. In a perfect world, it's ideal to have 1 to 2 people of a younger generation who can step in and help execute your wishes. So when we say legal documents, it's primarily a medical power of attorney, which is your medical needs. There are durable powers of attorney, which are more of your financial needs. If you only have your spouse listed and you're the caregiver of your spouse, you really need to think through identifying a secondary to any of your documents to make sure that someone is able to execute on your behalf. Same with a HIPAA release. That's Health Information a Protection Act. And so who can actually get a hold of your health information? This is important in every healthcare system. And so it doesn't matter where you are, probably outside of the home, but any senior living community, any hospital, they're going to need to know who can they talk to. And these are the documents that you need to have readily available. And again, stored with the other information from the previous screen to help people know who's the right person to talk to, and who can make decisions if you're not able to do that on your own. You want to have written wishes for your care, your directives to physicians, but we would argue to take it a step further. So your directive to physicians are great, but I think that there's more to a picture than just if you want a feeding tube or not. So as much documentation as you can in terms of documenting your wants, wishes, and desires. Do you want to go into a senior living community? Do you want to stay at home? Do you understand what those costs are? Have you had these conversations with your families? Documenting as much as possible is really key in making sure that you're able to get to the place where y'all want to be. And then in thinking through legal documents, who is the best person to make medical decisions on your behalf? I met with a client this morning. She's a lady who does not have any family. She has a niece, and she just didn't really trust her niece to make her decisions. So she really needs to come up with a plan for who is going to be able to do that. Sometimes there's professional services like ourselves. Oftentimes people don't need that, and they have people who they're able to identify. But again, just making sure, particularly if you're a caregiver, and y'all have like your caregiver is still listed on your power of attorney and y'all don't have anybody listed as secondary, identifying people who can step in and serve in that capacity if the person you're caring for is no longer able to do that is really important to making sure things can flow properly. So if you have not taken a look at your legal documents in a while, I strongly urge you to do that so you have just a good current understanding of what you have in place. So again, current, easy to update, and access, meaning people know where to find it. If it's hidden in the bottom drawer of a filing cabinet, it can be very hard to find in an urgent situation. So it's less helpful to you in navigating healthcare systems.
Can I interrupt you, Julie, while we're just there, since we finished this piece about documents? There's some questions that I think are relevant to that section.
Sure.
So Danielle asked, for surgeries and hospitalizations, how far back? So how far back do we need to keep that information?
That's a really good question. I would say at least the last 15 years, unless there is something significant. So for example, they don't really need to know when you had your tonsils removed, but it may be important depending upon your health status to know when you had a hysterectomy. So I would put major surgeries on there almost no matter how far back it goes. If there's a possibility that it may influence healthcare issues down the road, but minor things from 15 years beyond are probably not anything that you need to. I would say it's good to put it on the form, but you don't necessarily need to know the date. If you just want to keep track of that.
Just
Does that
helpful
answer
to
the
know.
question? Yeah.
Yeah, just helpful to know that you have had your tonsils out, you have had your knee replaced, that sort of thing.
Yes. Mhm.
Okay. Another question was asked, why do we need to include Social Security answers in there? Or Social Security numbers, pardon me.
Yeah. So hospitals do tend to need Social Security numbers. And so what we have found, particularly with insurance providers, is that they'll want to have a Social Security number. And we're not saying it needs to go out to everybody. It just needs to be documented somewhere safe. So if somebody needs to have access to it, they will have access to it. For a long period of time, people just relied on their Medicare card, and you can't really do that anymore. But for example, when we do medical releases of information for our clients to access medical records from a doctor's office, we have to have a social security number to do that.
I think that's good for this moment. Thank you. We'll move
Okay.
on.
Sure. So stages available to plan, which is, stage 1, which is where we all really want to be, which is in complete control. So you're able to get all of this set up for yourself, or your loved one that you're caring for, but you're able to really initiate that on your own and handle what you need. Stage 2 is that you're already needing assistance. So if you have a loved one that you're caring for that is already needing assistance and their wishes are not documented, if at all possible, still try and talk with them, about what they want. Document conversations that you've had historically about, aging and what they ever expressed about, their wants for end of life. But you really want to start planning in stage 1 if at all possible. Usually, oops, I'm so sorry. How do I go back? There we go. I was trying to move this little thing. But stage 3 is when someone else takes control. Usually for our type of services, we tend to see people in stage 2 and stage 3. So anyone who's joining this this webinar, I really feel like y'all are in a great position to be at least in stage 1 or stage 2 and gain some control over what this may look like for your future needs down the road. When someone else is taking control, meaning you're no longer able to communicate needs for yourself and someone is executing on your behalf, if you don't have all of this documented, they're just guessing. And a lot of people certainly want to do right by you. But there are people who just generally don't have any idea. And because it's never been discussed, they may go off more of what their wishes are than what your actual wishes are. So as much planning as you can do, the better off you will be for setting yourself up for a successful navigation of a healthcare system. This is our slide for our services, but I did want to highlight when you're talking about navigating a healthcare system, just know that during all of this process, you don't have to navigate things alone. You have wonderful resources like Age of Central Texas, Area Agency on Aging, the Capital Area Aging and Disability Resource Center, Connect ATX. There's a lot of organizations. We are very lucky in the Central Texas region to have a wealth of resource and knowledge available at your fingertips. And so I encourage you to reach out to those entities if you're feeling like you're struggling in a particular area. For the type of work that we do a lot of hand-holding, and so can walk alongside people in navigating that healthcare system. Sometimes it's a matter of being really prepared up front, and sometimes even the best laid plans, and you feel like you've really been prepared, but you're now in a crisis situation can really feel overwhelming. And so companies like mine, CareFor, who can do care management, there's other companies like ours, MIR, Senior Services of Austin, we are all here and work together to make sure that people have access to professionals who know the right questions to ask, how to understand what the next best plan or step may be. And so you don't have to do all of this alone. The idea, though, is that if you start working on the pieces that we talked about, you'll be far more prepared to get through the maze of healthcare than people who are not. And when I say maze of healthcare, healthcare operates often in silos. The hospital has its function and it doesn't really know what happens in the home. When you're at home, the hospital or the, you know, skilled nursing doesn't really know, what's been going. And so it's really the responsibility of the person and then any team that they can have around them to bridge those gaps to make sure that you're getting all of the things that you need when you're advocating for yourself or for your loved one. So this is just a slide about what we do, but know that there are a lot of really good resources, particularly here, I feel like are really exceptional at making sure people understand, good next steps. And I hope I didn't finish too early, but I was afraid to go too deep into any too different area, but I'm really happy to answer any questions that anyone may have, or if y'all want to go back and see any of the slides to delve deeper into it, please let me know, Bonnie.
So yeah, everyone, I just want to let you know that if you put questions into the Q&A, we can answer them live. You can also put some comments or in the chat if there's anything you want it more specifically covered. We did have one question in the chat. It says, what, according to you, needs to be a role of government and authorities in effective navigating systems of care? A big, deep question.
I know. Say it one more time. Say it one more time.
And it makes me think that link that Shirley sent in earlier that I'll put in the chat again, that survey link is something that the government is actually asking for our feedback as caregivers and aging folks in the community to give this feedback so that they know how they can support us as we're aging. So the question was, what, according to you, needs to be role of government and authorities in effective navigating systems of care?
Wow. What role of government?
I'm gonna open it up. Actually, I'm gonna pin back. I'm gonna ask Shirley Trapani, who is with the Area Agency on Aging. I've asked her if she's still available to open up her video and we can have the spotlight back on her, because working with Health and Human Services and the Area Agency on Aging, she might be in a better position to answer this question and talk a little bit about the role of governments, particularly as the Area Agency on Aging is funded by the Older Americans Act and so on and so forth. So I'm going to ask her and maybe Rhonda Thompson, who's also with CapCog and the Area Agency on Aging, if they're available, and see if they can come back on.
Yeah, and really until they get there, what I see is the function of the healthcare system is really about your providers and your insurance, and then what you can afford to pay out of pocket. That's what I mostly see. So the government piece, I would definitely toss it back to one of them.
Okay. Hopefully we'll come back to them. I'm going to double check in the chat and see. There was a question about, are any of these services free or covered by Medicare?
And is there a specific service that they're referencing, or
they weren't? But let me see. Jeanette, do you want to, is there something specific that you're thinking about? You can put in the chat. I'll just wait a quick second.
And I can say, so for like your resources, accessing Austin Groups for the Elderly, or Age of Central Texas, Area Agency on Aging, those are your free, resources, more nonprofit providers to answer any just kind of questions related to services available, things like that. If you really need someone to walk alongside you through a health event. Typically those are going to be fee for service. So like our services for our care managers to be involved in helping to advocate for someone in the hospital or to complete an assessment and come up with a plan for resources to access, we charge and bill for our time. And so that's for someone who may need just more of a personalized plan, not really sure where they're, starting, and so need that clinical eye to come take a piece or walk alongside through a health event. But certainly, those other entities have resources that are available to the public at no charge, where you can, work with someone, usually at their agency, to get the information that you need.
Someone was asking about that, about how much it costs to use services like CareFor or Mirror Care, those aging life care professionals. And do you have a ballpark, or how does that?
Yeah, so for the Austin area, and I would say Georgetown to San Marcos, probably, for care management services, I think we're all the same price, but it's $175 an hour. You bill it in 15-minute increments for time that's used. That's generally what a care manager rate is. And with those services, you can use them as little or as much as you need. So sometimes people will come in, they just need, like, there's something urgent going on. Again, like we've got a case today with a gentleman at a hospital. They're trying to discharge him home with wound care. Like, nobody in the home is set up to do wound care. And so they are not sure what to do. So they called us, and we're going to go to the hospital and triage that situation for the family and advocate for them. And that may just be a moment in time. And then once they get things sorted, we're not involved anymore. Some people have a lot going on, and so we stay involved over time. It's really however little or as much people need, but we all kind of work similarly. So it's the same for everybody. You just kind of use us as you need us.
Super. Shirley, we see you and you're here. We were hoping that maybe you could, as the representative from the AAA, CAPCOG, there was a question about the impact of government in navigating systems of care. And this person has kind of asked a subsequent question, how, according to you, navigating systems can support improvement care for older persons from poor and low socioeconomic groups of population. I'm going to actually let them know. I'm going to see if we can get them to talk, to give us a little bit more insight on your question. Are you able to talk? I think I've given you permission to talk. So if you are available, the person who asked that question, maybe not.
Shmi.
So Shirley, would you be able to give us a little bit of some insight on what the government's role is in helping to navigate systems of care?
You hear me?
Oh, we can hear
You
you.
hear?
Yeah. Yeah, I've made it so you can talk.
Okay, I now will ask my second question. I want to ask you how navigating systems can support improvement care for all the persons, all the adults from poor and low socioeconomic groups of population.
So Shirley, did you get
I'll
that?
take that. I'll take that. I'm kind of reading it as well. Part of what us as nonprofits do, like the Area Agency on Aging and AGE as well, we go out into the communities and especially we try to reach some of the rural areas where people are of lower socioeconomic status. We try to provide education and resources to people in those areas. And the more resources and education on what's available and programs that certainly help some of what might be lacking in that local community. So the more we can get out into the communities to provide education and resources and understand what resources are not there, then we continue to reach out. We work with Health and Human Services Commission. We let them know what's going on in our local communities. So it's really about understanding the community and understanding what resources can be placed in that community, and making sure that families and professionals, hospitals, clinics, all the people that serve our populations, that we have communication and awareness and provide those resources.
Thank you. Thank you. I hope that
Thank
helped.
you.
At that time too, Shirley, you know, I mentioned, and I'll just say it again, that survey that you posted in the chat earlier
Yeah,
helps governments like Health and Human Services figure out what services are best to provide. Is that right? Oh, you're muted, Shirley.
we would appreciate if people can complete that survey, because it really provides, that's going out to the entire state. And so it really is gonna, you know, we'll find out kind of the results for more focal of the Central Texas region about what people are asking and needing. Because we'll ask that question of HHSC once the survey period's done. We're gonna send them a question and say, what are the people in this central county in this more immediate area? But then I'd also like to know what's going on statewide too. Why does someone have more resources than we do in certain areas? Why don't they have enough? So I'd like to understand that too, because I come from working for the state for many years, so I kind of always like that. Well, I have to look at the local area, but I really like to understand what happens statewide too, because it does affect different populations throughout the state. And you know, some are we have a lot of rural communities in our state. So that's
If I could, oh, sorry.
that's
Go
where
ahead,
the
Shirley.
oh, go ahead, Rhonda. Yeah.
Oh, no, well, I was just gonna say, we also do an area plan every couple of years for our 10-county region. And it's all the area agency on agings are required to do an area plan. And in preparation for writing the area plan, we do surveys and focus groups on what the needs are from the different communities and counties, all the counties that we serve. Last year, or our last area plan, we had almost 500 responses, which was amazing. And we were able to take that information and incorporate it into our area plan for the next and I'm not sure the exact years, but every two to 3 years we do one. And so we try to make sure that we're meeting the needs that have been identified by people in our community, in our region, in our communities.
That's great. Great to know. Great to know. We always want to make sure that we have an impact and that our voice is heard and our needs are met. So if there's not any other questions, I have a quick question for Julie. Julie, when I get calls, so many people on this call might not know I'm the program director for information and resources. And so people call me and they don't know where to start, or they don't know who to ask for, or who to ask for help from, or what to even ask. And so we talk about CareFor and other geriatric case managers, but what would trigger somebody to really reach out to you as opposed to the area agency on aging or something like that? Like, just to give people kind of, is there a stair step of when they should reach out? You may have covered this a little bit in your talk, but if we could just go a little bit deeper into that, would be helpful, I think, to a lot of people.
Sure. So what I would say is people call us at all stages, because our founder, Debbie, she is a very big proponent of planning. Like, she's written a book, she's created a workbook to accompany the book to make sure that proper planning is in place for people who are trying to be proactive for whatever lies ahead. And then we've got those people who reach out to us. To typically it's the people who there's already a health event going on and they really just don't know what to do. So I take all of the calls for the Austin area. Debbie actually takes the calls on the weekend, but even if they start with us, I wouldn't necessarily say it's a stair step, but if they start with us, I am happy to have that conversation, talk through what's going on. If we're not going to be the best fit for them for whatever reason, cost, location, whatever it may be, I try, and our company and really all the geriatric care managers in the area, our responsibility to our clients is to keep a pulse on the healthcare market, resources and services for our area. So if we cannot help, I will be the first to say, I really feel like you need to reach out to Age of Central Texas. Their Thrive program may be a good fit. Ask these specific questions. Or have you checked this particular website, maybe more disease related, to get some information and resources specific to a diagnosis. So if we can't help, we don't just say, thank you so much for calling, and good luck to you. We definitely try and guide them to people who would be able to help. And again, I just really have a lot of nice things to say about our group of healthcare providers for the Central Texas area. It's a very supportive network. We all talk to each other. It's good, healthy competition for different services, but really at the end of the day, I think all of us are in it to make sure that people get the resources that they need. So if it's not us, it's with Age or Area Agency on Aging or whoever. But we certainly are familiar with other opportunities for resources that may be either in line with cost or location or disease specific that are readily available to other people. So I guess to answer that question, start with y'all, start with us. I think
There's
the
no wrong
biggest
door.
message is just to ask, reach out and ask. You don't know until you ask the question, and there are people who you can get an easy answer from sometimes, versus we get a lot of calls where people have just they've been struggling and it's just been an unnecessary struggle. And I'm like, oh, I wish you would have called me 2 weeks ago. Cause, even if they couldn't afford us and we couldn't help, I could have told you, this is what you need to ask. This is what you need to tell the hospital. This is the next person you need to call. And then you can take it and run,
I appreciate that. Just one last little quick comment before we wrap up our Q&A. This conference is geared toward caregivers, but we know that there are a lot of older adults in our community who are aging alone. I refer to those people as aging as solo seniors or solo agers. And I feel like sometimes people don't know that when they're solo aging, they can also benefit from using or learning how to navigate systems of care and putting those plans into place, the emergency plan, the what if plan, the this is what I want to have happen. Do you have any quick comments on that as well?
Absolutely. We work with a large group of solo agers. We will serve as medical power of attorney, primary or secondary. And so we do tend to work with a lot of people who either chose not to have kids, don't trust their kids, don't have family, families across the country, whatever the case may be. I think Debbie used to say something, hope is not a plan, so to hope that everything works out, it usually doesn't. And so making sure that you've got what you want for yourself documented and outlined is just so critical to making sure that your wishes are executed. And I think it's very important, nothing changes for you as you're an older adult. Like you're still wanting to make your own decisions, be as independent as possible. And people don't want to guess for you, just because I want to be cremated doesn't mean you do. And so having as much of those conversations with people that you know and trust and documenting is just so critical. But there's a large group of solo agers, and we're happy to, provide services to those. Sometimes we call it contingency care. And whether you use us or you find a friend group, having that contingency plan for what should happen is so important and critical. And it's also not just about care and like what you want, but if you can't speak for yourself and you're a solo ager, how can people know what your insurance is? Like, how can people know how to pay for these services for you? Those things you really need to think through, so that way, not just the medical piece can be executed, but the financial pieces that also come along with it, and having people know where to find that. So come up with a contingency plan, because the reality of it is we all know the ending to our story. And we all are going to go through end of life. And so it's really critical. We just see so many sad stories of people who did not plan. And this is like, you have the opportunity to speak for yourself. So take that opportunity and reach out to someone, us or a friend or whoever, to make sure that that is documented for you.
Super. Thank you.
Mhm.
Thank you so much, everybody, for being here. I'm going to pass the baton to Bobby, and he'll wrap us up.
All right, thanks, Bonnie. Before we wrap up, I just wanted to ask everybody who's attending to please put your first and last name into the chat so that we can take roll. All right, because some of us are under phone numbers or an abbreviated name or first name. So we just want to make sure that we count everybody. Also, don't forget to do the survey that you receive. We're going to be emailing those out, and plus the one that Shirley asked us to do earlier in the program. So your input, remember, your input really helps us to plan for future conferences, as well as provide metrics for our funders. And I want to thank Tomas Montano for his sponsoring today with Vitas Healthcare. And also, Julie, I want to thank you for just a fantastic presentation that you gave. It's very, very helpful. And lastly, I want to thank my colleague and partner in this session, Rhonda Thompson of the Area Agency on Aging at the Capital Area. And then most of all, thank all of you who attended today, who joined us for our second of four. Actually, this is our third virtual session of this 23rd annual Striking a Balance Caregiver Conference. And there's also still time to register for Saturday's live event if you haven't already. It's going to offer some really good opportunities for in-person one-on-ones with our resource providers, as well as an opportunity to meet other caregivers and talk with them, have a good lunch, and then learn much more about becoming a resilient caregiver. It's also free, so you don't want to pass that up. We'll be back again tomorrow at 1 p.m. So just use the same Zoom link to log in for the other sessions. And we look forward to seeing you.
Thank you, everybody. Have a good rest of your day.